Good afternoon. My name is Dr. Hui Nguyen. I am the Interim Executive Director of the Boston Public Health Commission. Thank you all for being here today. I would like to first thank Charlie Murphy, the President and CEO of Harvard Street Neighborhood Health Center, for hosting us today and for being such an exceptional partner in delivering high-quality health care to the residents of the city of Boston. I would also like to thank Jean Yang, Executive Director of the Commonwealth Health Insurance Connector Authority, for joining us to underscore the importance of health access and affordability. You'll hear from each of them in a moment. First, I'd like to introduce Felix Arroyo, Chief of Health and Human Services for the City of Boston, to say a few words about the importance of getting signed up for health insurance. Chief Arroyo.
Thank you, Hui. Good afternoon, everybody. I'm happy to be here today on behalf of the mayor and talk about the importance of signing up for health insurance. Since 2006 health reform, Massachusetts had the lowest rate of uninsured residents in the nation. However, that doesn't mean that there are not those out there who still don't have health insurance. Those who remain uninsured are disproportionately younger, male, Latino. Jeffrey, I think they're talking about you and me.
I got my
Yeah, I'm sure. Back up, yeah. Non-citizens, low literacy, and limited English skills. What many people may not know is that the majority of the uninsured, in fact, work for a living, including at least a third who are working full-time. Less than 1/3 of those uninsured workers have had access to employer-sponsored health insurance. This is why this is important, and this is why this matters. Luckily, thanks to the Health Connector and the implementation of the Affordable Care Act, most of these folks are eligible for coverage that is more affordable and comprehensive. So we're here today to remind people that beginning November 15th, the state's open enrollment period will begin, and the Mayor's Health Line is here to help. Thank you.
Thank you, Chief Arroyo. We know that Boston has some of the highest rates of all of these vulnerable and under-enrolled populations. By working with our community partners who serve immigrants, the homeless, those leaving incarceration, as well as the city's many higher educational institutions, we are confident that we will be able to reach these individuals and families and then assist them in applying for coverage. We will collaborate with unions, community-based organizations such as the Vietnamese American Civic Association, local colleges and universities, the Suffolk House of Corrections, faith-based organizations, health centers, homeless service organizations, local businesses, including auto body shops, nail salons, and barbershops, and family service agencies. We will provide mobile navigators who will travel throughout the city. We will also implement a media campaign in conjunction with the Massachusetts League of Community Health Centers. One of our key health center partners in this effort is Harvard Street Community Health Center, which serves some of the most vulnerable residents in Boston. And I'd now like to introduce Dr. Christopher Zimmerman, Medical Director of Harvard Street, who is going to talk about the health center's role in getting patients connected to insurance.
Thank you very much. I want to first welcome all of our guests from the Public Health Commission, our representatives of the city, the media. I want to welcome you all to Harvard Street today. Here in the neighborhood health centers, we're providing care for those in need, and access to affordable care is an incredible important part of that our patients often need assistance in terms of getting the care that they need, and working in partnership with the Public Health Commission to make sure that they have affordable care is really our goal. I want to thank you again all today and welcome you.
Thank you, Dr. Zimmerman, and thanks to everyone here at Harvard Street for your partnership. I'd next like to introduce Representative Jeffrey Sanchez. Representative Sanchez is the chair of the Joint Commission for Public Health, and he's here to speak about the importance of healthcare in our community.
Thank you, Commissioner, and to Chief Arroyo, our health czar. It's a pleasure to see you. And Jean Yang, thank you for taking the time. Come over on the side. Don't hide over there. This is your show. You got to be up front and center. Thank you so much for being here today. Again, this community health center, it's a beacon for so many people in this community, especially, again, those underserved in our community directly. And I want to thank the leadership here, Dr. Zimmerman and Charlie Murphy. I know he's not here, but you send him my best. We served together in the legislature, and I appreciate that he's decided and taken the opportunity to be and work hard here at Harvard. You know, back in 2006, we in the Commonwealth of Massachusetts embarked on something that all of the states thought that we were crazy on, that we were going to insure the entire population. And we were going to make sure that that we focused on poor populations and underserved populations and getting messages out about not only having an insurance card, but also making sure that there's care and that there's access with that insurance card. And from 2006 to now, we in the legislature have made sure that we try to make sure that we live up to that mantra. It is a challenging mantra, especially the challenges that we have in containing costs, but also making sure that our system is of the greatest quality in any place on the planet, which I think is, but we still do have a lot of work to do. This event that's here today is to make sure that we bring to the attention this enrollment day of November 15th. We have to make sure that it goes by flawlessly, that we make sure that we get in front of as many people as possible, that it's in the churches, that it's in the community halls, that it's on the streets, that it's in the restaurants, everywhere that was mentioned a moment ago. And it's so important because we want to make sure that, again, that we get to everyone. Everybody has a card, everybody is taken care of and is a part of our system. I want to do this in Spanish because I want to recognize that Univision is here, and they are a great partner with us in getting messages out. So I do this in Spanish as well so that they can bring the message to the community as well. So primero, yo soy Jeffrey Sánchez, representante del Estado de Jamaica Plain, pero también sirvo como el director de la Comisión de Salud Pública dentro de la Cámara de Representantes. Estamos aquí hoy porque, primero, la reforma de salud afecta directamente a las familias en todo nuestro estado. Hay nuevas opciones de seguro que están disponibles a un costo muy reducido y bajo. Y hay muchos planes que pueden asistirlos a estar seguros, están asegurados y están recibiendo el cuidado necesario. Las inscripciones se abren el 15 de noviembre, este próximo mes que está entrando ahora. Y si tiene cobertura temporaria o tienes Commonwealth Care, tendrán que aplicar de nuevo, incluso si aplicó en el 2013 al 2014. Es parte de la ley que nosotros establecimos en el 2006. Van a haber navegadores para que puedan ayudarle a hacer varias cosas, contestar las preguntas, explicarle las opciones, ayudar con las inscripciones en el plan adecuado y además de eso, ayudarle a encontrar un proveedor de atención médica. Esto es de tener cobertura, pero a la misma vez estar seguro que tienen esa atención médica que se necesita. Muchas gracias a ustedes que están presentes hoy. Thank you everybody for taking the time for doing this today, and to Jean Yang, who is running the show, and she's doing a great job. This time around, we're going to knock it out the park. I feel very positive about that.
Thank you, Representative Sanchez, for all of your leadership and for your continued support of the residents of our communities. Finally, I'd like to invite Jean Yang, Executive Director of the Massachusetts Health Connector, to talk about the Connector's efforts to reach Boston's residents.
Thank you. Thank you, everyone. Thank you, Representative Sanchez, for your leadership and your unwavering support throughout the many, many years. My name is Jean Yang. I work at the Health Connector. I've been playing this role for a couple of years. It's a tremendous learning experience for me and my team. Thanks to everyone that have been working so much with us. Thank you, everyone. I share the pride expressed by Representative Sanchez and everyone in the tremendous achievement by this great state in healthcare reform. I celebrate every day at what we have done when looking at people, real people who have health insurance and having regular access to healthcare. Healthcare is a human right, and it is our job to make that the highest priority of this government and everyone that we work with. That being said, I do want to take a moment to acknowledge that we have had a very, very challenging year that has caused tremendous pain and difficulty to many, many people. Not only people who are trying to get access to health care, but also people who work with them to help them. We apologize for the problems that we have had. We take it very, very seriously. Thankfully, Governor Patrick's administration, working very closely with the federal government, came up with creative solutions in light of the problems that protected people's coverage. So that has not only protected and preserved access to health care by hundreds of thousands of people, it also gave us the opportunity just to put our heads down and fix the problem. And I'm glad to say that I am increasingly confident that we have nailed it, and we're going to have a website that works. It is going to be turned on November 15th. We have a lot to prove to you, and we're looking forward to that opportunity to prove things to you. We continue to welcome your scrutiny, your criticism, anything that you can do to help us do a better job. Now, let me just tell you a little bit about what we have to achieve here. Obviously, we are surrounded by great leaders that are committed to helping us and making sure this is an all-hands-on-deck effort. I would like to emphasize it does take an all-hands-on-deck effort to pull this off this year. We have a very short period of time, about 90 days, to reach out and help a very high number of people. We're going to be actively working with up to 400,000 people who are in various forms of legacy or temporary coverage, many of them you see every day, that we need to help them take action and transition to permanent ACA-compliant coverage. We have a system that is ready to serve them, but they need a lot more help from all of us to make sure this happens. Open enrollment is happening on 11/15, and people need to fill out an application. We encourage them to go online because the website is going to work. We do have paper options, but we encourage people to maximize the technology because that's the best way to do it. We need people to be very careful reading their mail because that is an important venue where we communicate personalized information, whether they need to take action, where do they go, what are the key dates. We need all of you to spread the word to draw people's attention to their mails. We will have an outbound call campaign that people will receive phone calls, reminding them, we're educating them what's going on. There will be people on the street knocking on doors, reminding people to take action. We will be knocking on about 200,000 doors during the 90-day period. We're going to have an advertising campaign that is going to be overwhelming coming in a month's time. The messaging is going to be take action and help is available. Now, one of the main reasons why I'm here today, in addition to joining all of you to talk about what is happening, is obviously to introduce and reintroduce our navigator partners, the Boston Public Health Commission. It was a navigator organization and will continue to be a navigator organization for this year. These are the true experts that can help us get this done. These are organizations that come in with the knowledge, the relationship, the language, and the things that they have been practicing every day to make sure that we do the right things. We give them some tools, some information on how ACA works and what's the policy and et cetera, but they really teach us every day in terms of how to get this done. So we are privileged to have Boston Public Health Commission and the other 14 organizations that are navigators, that are working side by side with us, in addition to virtually all of the hospitals and community health centers like Harvard Street that we're in today, that are certified application counselors. These are professionals that are trained. They know how to use the system. They understand the rules. They can give people the help that they need. We are relying on them. We are proud to have them, and we look forward to working with them closely every day. Thank you, everyone.
Thank you, Jean, and thank you for all the hard work that your agency has put into making sure that we are ready for open enrollment. We are grateful to the Massachusetts Health Connector for giving us this opportunity to serve the children, families, and individuals who will benefit most from this important information and resource. So I'd like to finally close by asking for everyone's help in making sure that residents of Boston know about the open enrollment starting on November 15th and also about the Mayor's Healthline and the Navigator free resource. The Mayor's Healthline number is 617-534-5050, 617-534-5050. Please help us spread the word and help us and continue to work with us to make a healthier Boston. Thank you.
Nice job.